Hi everyone, here we are, out on the bike again. It's a gorgeous day, absolutely gorgeous. It's quite warm actually. I put my textile on because it's that time of year and this is actually warmer than my leather jacket. But it's making me sweat a bit. It's a bit warm for it. So I've put the wrong jacket on basically. Anyway, that's not what I'm here to talk about. I'm glad it's a nice, sunny, happy day because the subject I'm going to talk about today, which is mental health, let's talk about it. It's quite a depressing subject, but it's got to be talked about. It's got to be put out there, and the stigma mental health problems has to be removed, I'm afraid. Our society is all too keen to put it on the back burner, if you like, and not mention it. You know, oh, my friend's got depression, oh, I'll have to stop visiting her until she's better. No, that's the wrong idea. Go round and see if you can do anything to help, is the idea. And you know, there are lots of different types of mental illness that anybody can be afflicted with. Don't think because you're a big strong muscly guy or because you're the most popular girl that you won't be afflicted with it, because it's a very fine line that we walk in our lives between happiness and despair. And when mental health gets hold of you, that's when you'll find out what despair is. And as I said, anyone can suffer with it. And there's all different types. There's depression, there's bipolar, there's anxiety, there's schizophrenia, there's lots of it. There's probably more than I can name. And you're probably saying, well, what do you know about mental health anyway? Well, I know quite a bit about it because well, it is sort of personal. It's a personal story, really. I know quite a bit about it, about depression, bipolar, paranoia. That's the other word I was trying to think of. Paranoia. Delusional disorder, schizophrenia. I know all about these from a personal aspect. Not that I've personally suffered from them, but my wife has suffered from all of these problems over the last 36 years. So, you know, it's a scary thing because a lot of people think, oh, once your medication's sorted out, you're sorted, you're mended. You're not. You're not, I'm afraid, because it can rear its ugly head at any time and pull you down. And the trouble is, it doesn't just pull the sufferer down, it pulls everyone around them down. You know, as I say, I've lived with it for 36 years, since my daughter was born, when it first came along in the form of what they called postnatal depression. And being a young man, a bit of a naive young man, in my 20s, early 20s, you know, thought, yeah, we're having a baby, that's great, we can enjoy this, you know, live happily ever after, diddly da da da, like most people would. You know, it's an exciting time, isn't it? But then, within a month of my daughter being around, we noticed my wife was very, very sad all the time. And I didn't have a clue. I did not have a clue. Luckily, my sister, who's no longer with us, unfortunately, God bless her, she pointed out to me that my wife is not well. So we managed to get her along to the doctors, and they decided that it was postnatal depression, not pression, depression. And in those days, I'm talking about the early 80s here, in those days the patients were hospitalised until they could work out a course of treatment for them that suited them, and then once they found the suitable treatment, they sent them on their merry way, basically. I don't know why I came this way. Yeah, so that's how they used to treat it. I'm not sure how they treat it now. I don't think they hospitalise people anymore. I think they just try and treat them in the community for that particular thing anyway. Yeah, so from that, my wife sort of got over the postnatal depression bit, but unfortunately that kicked off in her brain and left it open to general depression, which later turned into manic depression, which is now called bipolar. So she's been treated for all those, and a few years ago she was also treated for paranoia, and within the last 2 years, because it's 2 years exactly this month, and I remember it well, that my wife started accusing me of having affairs. Now, I've been totally loyal to my wife throughout our 38 years of marriage. Totally loyal. So yeah, she started accusing me of having affairs, and then she started accusing me of stealing things from her. And as I said before, because I know a little bit about it, you know, 36 years worth of sort of practical experience with it, I think to myself, this is not bipolar. It sounds more like bloody dementia and Alzheimer's type, you know, because that's what people suffering from that do. They accuse you of stealing things and doing other weird things. So anyway, I tried to get to see the doctor. She said no, there's nothing wrong with me, it's all down to you, these problems. Okay, right now. So on and off over the last 2 years, life has been hell, and that's why I'm calling this video really mental health. Let's talk about it, because that's the one thing I've never done. I've never spoken about it to anyone, you know, not friends, neighbours, relatives. I mean, all of her family know that she suffers with it. All of my family know that she suffers with it, but you don't talk about it, you know, because of the stigma around it. You just don't talk about it, and that's the biggest mistake I've ever made, is not talking about it. I've talked about it to my wife, obviously, trying to figure out what's kicked all this off in the past, and how we could sort it out, you know, but I've never talked about it to doctors or counsellors or anyone like that. And you should really talk about mental health. Bring it out in the open, because the problem is now, you see, is that my wife has now been hospitalised again because of the problems in it. It just grew and grew and grew, and I couldn't get no one to listen. I said I tried to get her to the doctors, but you know, you can't handcuff her and take her there, can you? So she's been hospitalised, and they've diagnosed her as having delusional disorder and slightly paranoid schizophrenic. As I said, I should have talked about this years ago. We should speak. You know, if you love someone that's suffering with mental health, make sure you talk about it. I mean, what the problem is, you know, if it's anxiety or anything like that, talk to it. Talk to people about it. Not just the one who's suffering. Talk to other people. Talk to your family members. Talk to your friends. Get it out there that you too are suffering, because you are. So because I didn't, and my wife has told all her family members that I've been having affairs left, right and centre, and I've been stealing this from her and I was stealing that from her, they totally believe her. They totally believe her, even though they know that she suffers from depression and bipolar and stuff like that, you know. So I'm an arsehole at the moment in everyone's eyes, which is why I'm making this video. Really, it's just to get it off my chest and get it out there. So if anyone else is in the same boat, talk to other people about it and try and get help for yourself, because you know, everyone says, oh, we should talk about mental health because men have the highest suicide rate, and you know, mental health needs talking about. Well, it does, of course it does, but not just for those reasons. It needs talking about to help the people around the sufferers that are also suffering, you know. And it's hard to deal with yourself. I don't care how tough a guy you think you are, whether you're muscle bound and totally fit, and you know, you can't do it all on your own, I can assure you, because I've tried for 36 years and it wears you down in the end. It gets to you. Yeah, so that's my story. That's the story of my dealings with mental health. As I said, I've never suffered with right shit there. Never suffered with mental health problems myself, amazingly. But I can see what it's like to suffer with it, you know. And a lot of people would say, oh, pull yourself together, you know, someone's down in the dumps or whatever. That is totally the wrong thing to say to anybody. You should not say things like that. You don't know what battles they're having inside their head. So do not say things like that, because that's not very nice. It doesn't help anyone. It doesn't help the patient, won't help you. You know, just isn't the right thing to say. What you should be trying to do is talk about it and persuade the person that's feeling down in the dumps. I haven't got a clue where I am. I should have, because I've come round here before, but yeah, you've got to persuade the person that's down in the dumps or acting strange that they need help, and that is the hardest thing to do, because the person that's suffering with mental health problems just doesn't realise that they are. You know, they think they're okay and the rest of the world is a bastard. So anyway, that's my little talk on mental health and how we should talk about it. So if you know someone that's suffering, then do your best to persuade them to get help. And if you live with someone that suffers with mental health problems, try and get some help for yourself as well. You know, you might think you're strong and tough, but you can't do these things all on your own. Try and get some help for yourself. Anyway, I've rambled on long enough about the problems that mental health can cause. Hopefully you're not suffering from any, and we'll call it a day on this one now. So whatever you ride it safely, and I will catch you when I'm out on another gorgeous day like today, riding my lovely Honda. But for now, from me, it's ta-da. Bye bye now.